Hi everybody, today we're going to be talking about how to make a nursing diagnosis. If you didn't get a chance to check my video on the nursing process, go ahead and check that out because the nursing diagnosis is a part of that. But for right now we're going to talk about how you actually formulate a nursing diagnosis. And these are very important because it gives nurses a common language. This is kind of like our own language. This is how we're going to communicate with each other. It promotes identification of appropriate goals, provides accurate and acuity in information. It can create a standard for the nursing practice, so this is what we base a lot of our care on. And it provides a quality improvement base, so this is also what we're going to base our goals on. So let's get started. There are two types, and if you notice up here, this is our nursing process. We are in the second step, so this is the diagnosing step. And there are two types. We have the actual and we have the risk for. So the biggest difference is that the actual is that there has been evidence that it has happened. So actual equals evidence. And the risk for is just that. It's more of a situation where something is at high risk to happen. So there's no evidence for it to happen. So those are the biggest differences between the two. So let's get into the details about actual. An actual nursing diagnosis has three parts. It has your NANDA, the related to, and as manifested by. So your NANDA, that is just your nursing diagnosis. That is your issue at hand. Related to, you'll see it written as this sometimes, is the cause. So what is causing this to happen? And a lot of the times too, it'll either be related to or etiology, which is just another word for cause. You could see that as well. And then your last component is as manifested by or as evidenced by. Sometimes you'll see that too. This basically is just your evidence. So what is your issue, what causes it, and what is your evidence? Because remember, actual nursing diagnoses have evidence. So this NANDA section, this was the biggest issue for me. How do you know where you're going to find a nursing diagnosis? Well, these are two books that I had to get for nursing school, but you can get them on your own. I know they sell them on Amazon. They're very, very helpful. They are literally just lists and lists of nursing diagnoses. And what's nice is that they categorize them into certain conditions, so that way if it's a respiratory thing, you know where to look. Another thing too, if you don't want to get a book, you can just search nursing diagnosis for, and you'll get tons and tons of different suggestions. So this is where you're going to look for your first part of your nursing diagnosis, your NANDA. So the best way to learn is to just jump right into it. So this right here is an actual nursing diagnosis, and I've broken it down into the three parts for you. So this first part right here is our NANDA, our nursing diagnosis. This is risk for falls. And you can see right here is related to, so this is the second part, related to cognitive status, and then as manifested by, you're going to need to write as manifested by or as evidenced by, forgetting to use the call bell. So this person is at a risk for falls because of their cognitive status, and it's because they're forgetting to use the call bell. So that is what we know. Another one, it doesn't necessarily have to be something that you observe. Your as manifested by, your evidence could be what the patient actually tells you. So for this example, our nursing diagnosis is self-care deficit related to right side weakness as manifested by patient stating, I can't give myself a bath. These ones are really great because the evidence is literally what the patient said. So I really like to formulate these ones a lot. If you can get a patient statement, that's awesome. But if not, you can put your evidence as something you observe. Evidence can also be maybe a lab value or a vital sign, signs and symptoms, or what the patient says. So there's a lot of different ways you can show your evidence. So I have an example for you to try. There's three components here, and I want you to put them in order. And I've given you a little hint box down here just in case you get confused. If you still need time, go ahead and pause the video, but if not, I'm going to move on to the answer. So the answer is spiritual distress related to death of spouse as manifested by crying and withdrawal. So this first part is our NANDA. The second part is our cause or our related to. And our evidence is as manifested by crying and withdrawal. So if you got it, good job. If not, you have one more chance after this one. So here's another example. Go ahead and pause the video if you need some more time, but if not, I'm going to move on to the answer. Okay, so the answer, risk for infection related to compromised immune system as manifested by low white blood cell count. Risk for infection is our NANDA, related to is our cause, and our evidence is as manifested by a low white blood cell count. So our next type of nursing diagnosis is a risk for diagnosis. And remember, this type of diagnosis does not have evidence. It's just something that is highly likely to happen. It has a high potential of happening. So there's two parts to this one. You have your NANDA nursing diagnosis, and then you have your risk factors. So there's only two parts because, like I said, you don't have any evidence. So once again, if you're having trouble finding your NANDA, all you have to do is either get these books, look in your nursing diagnosis books, or like I said, you can Google anything and you'll get a great list of things to use. So an example, risk for aspiration related to inability to swallow. So this would be our NANDA, our nursing diagnosis, and related to inability to swallow would be our risk factor. We don't have any evidence that this happened, but we know that if you have trouble swallowing, you're at a higher risk for aspiration. Okay, so because these are pretty easy, I wanted to jump into an example right away. Go ahead and pause the video if you need some more time to put it together, but if not, I'm going to jump into the answer. So, risk for falls related to right-sided paralysis. Risk for falls is our nursing diagnosis, and related to right-sided paralysis would be our risk factor. Once again, there is no as manifested by because we don't have any evidence. We can highly suggest that right-sided paralysis could cause a higher risk for falls. Alright everybody, that is how you put together both an actual nursing diagnosis and a risk for nursing diagnosis. I hope I helped you guys out. I hope I cleared some things up. Don't forget to like and subscribe, and I'll see you guys in the next video.